So lots of questions about the cost of dental implants. So what affects the cost?
Well, I got a little cheat sheet here I made for myself
Okay.
because what I found, there's about 9 things that affect the cost, Randy. The first being the actual cost of the material that we're putting in your mouth, the dental implant.
Okay.
Generally those implants run about $400 each, and there's a variety. We can use multiple different brands and types of implants, but that's the first thing that's restricted for us, and it affects the cost. We literally have to pay for the implants that we're putting in your mouth. The next thing are the amount of doctors involved.
Okay.
Generally for this procedure, as you'll see across the country, is you go to one place for the dental implants, you go to one place for the bridge.
So one place for the surgery, another place where they put the teeth on.
Yep.
Okay.
Yep. So multiple offices, you're dealing with labs. The nice part about with us, we do everything in-house. I'm the only doctor you have to see. So I do everything.
So one doctor, one fee.
That's it. One doctor, one fee. When we streamline this process, that really helps us to reduce the cost there, okay? The other part that affects the cost is each and every patient is different. What Mrs. Jones might need is not what Mr. Johnson needs, okay? So each person is different. Some person might need bone grafting. Some people might need a specialized type of implant that we place behind the sinuses. All these other factors
Affect the cost.
affect the cost.
Okay.
It's a difference in the surgical approach to it. The other part is the large lab bill. By 3D printing and doing everything in-house, we're able to reduce that cost. It's like we place the teeth, we print them in the next room over, or we place the implants, we print the teeth, and we put them in your mouth and fix them on those implants. We attach them to the
All right there.
All right there. That
And
day.
that's not how it's usually done.
No,
you're saying. Okay.
no.
Okay.
Usually you're sending this out and having labs do
Now
this
you're
procedure
on the road
for you.
teaching this all the time, right? How to do this process?
I'm getting less on the road and trying to get more people to fly to me. But yes, we're teaching this all the time, especially 3D printing for sure. And remember, insurance coverage on this, that's another part. Insurance generally doesn't cover this procedure.
But what if you have really good dental insurance?
The best dental insurance covers $1,500 to $2,000 a year. And I haven't met the person that has $2,000 worth of coverage.
So then what's the answer?
The answer is financing.
Okay.
Not just in my office, but around the country, 80–90% of people are financing this procedure.
That's nice.
Yep. The other thing that affects the cost of this procedure is materials. And you'll see a lot of people use plastic and denture teeth for these
So what the teeth are made out of?
Yes,
Okay.
the actual teeth are made out. We use zirconia. Zirconia is a type of porcelain, and it's the gold standard of this. It mimics the teeth in translucency, color. It actually has the proper strength to where you can chew the food you want. I see this all the time. Someone calls, or I get a treatment plan from another office, and I go, well, that's apples to oranges. That's plastic. This is beautiful.
Okay.
This is actually ceramic or porcelain. So the next thing that affects the cost is the warranty of the doctor. We're able to offer a tremendous warranty because we use high quality materials. Our materials are built to last. We offer 5-year warranty on our fixed teeth.
That's nice.
Yeah, the ones that screw into the implants because they're made out of such good stuff. The other thing is, a lot of people with these advertisements you think that you're getting teeth fixed on dental implants or teeth screwed in that don't come in and out of your mouth. What they're actually getting is a snap-in and snap-out denture, which
you don't like those. Why?
I don't like them because patients don't like them.
Okay.
It's still a procedure that I offer, but I'll tell you this, I'm doing less and less of them by the week because, I always have patients, every time patients get a denture, they have regrets. They can't chew the same. It covers the roof of their palate. Their face changes because it takes up extra space in their cheeks. You know what? No one ever has a regret getting teeth that are replaced on dental implants that don't come out. Their biggest regret ever is that they didn't do it sooner. So again, you just want to be aware of the snap-in dentures. They're not the same as what we're talking about here. So, and last but not least, that what goes into factoring into the cost is experience and training. Listen, I have a little bit of a bias. I've been doing this for a while now. I've been doing it for about 8 years. You want someone that has that experience, that knows what they're getting themselves into, that gets it right the first time.
And you teach it.
You teach it, and we teach this process.
You write about it.
We write about it.
You dream about it.
I live, sleep, and breathe it, Randy. That's for sure.
Very nice.
So
when somebody calls then and says, "Hey, how much are implants?" I guess it's just not that simple. In fact, would you even consider it misleading to give a price without looking at the patient?
Absolutely. We can quote the price of the materials and what this is going to be, but the bottom line on the procedure, we need to look at you because each and every patient is different.